Breast milk is a strong source of nutrition for babies, yet only 1 in 4 infants get it exclusively, according to the CDC. In tonight's Eye on Health, WSBT 22's Anne-Larie sits down with experts who tell us why awareness of breastfeeding is helpful for both mom and baby.
It's a question moms-to-be hear for 9 months. Do you plan to breastfeed? Tia Kling, a registered nurse at Elkhart General Hospital and mom of 3, says she knew the answer all along.
I knew I wanted to breastfeed as soon as I found out I was pregnant.
But it's not always as easy as it seems. Even for Kling, who spends much of her time helping and teaching other moms to do it, she herself faced struggles breastfeeding with her second child. She says at first it can be discouraging, but it's part of a journey many moms and babies go through together. Michelle Kaufmann, a certified nurse midwife with Beacon Medical Group, says the reason she and so many other professionals encourage moms like Kling to keep going, it has so many benefits.
For babies, it helps to decrease the risk of asthma, allergies, obesity, diabetes. They get sick less often. And for moms, it decreases the risk of breast cancer, ovarian cancer, uterine cancer. And interestingly, we're learning that it also improves our heart health.
With benefits like that in mind, Kling sought out extra support during her journey with an option many might not even know they have, a private lactation consultant. There, professionals do things like weighing the baby, reassuring mom things are going the way they should. It was a resource Kling says was incredibly helpful.
Each challenge, I had to relearn her, and she had to also learn to overcome that challenge. I found comfort in knowing that it's a learning process. There's a growth curve with each child, and that is the bonding that we talk about with breastfeeding.
While it can be discouraging when things don't seem to click right away, Kaufmann says there are options. She says natural doesn't necessarily mean easy, and that you don't have to be all in.
Any amount is going to be helpful for both mom and for baby. We have formula and it can be very helpful. And so we're here to support people in whatever their goals or plans are. Those things can change.
Kaufmann recommends breastfeeding classes for moms-to-be and their support systems, as up to 4 hands are initially needed to start breastfeeding. In her words, it takes a village. And during a month that emphasizes the education on and awareness of breastfeeding, Kaufmann and Kling say that's sometimes all mom and baby really need.
The more we can normalize it and support it, the more likely that more people can do it.
The socialization and normalizing of breastfeeding is so much more important than I knew before I had my first child. What you can do is just be understanding that not everybody's journey looks like yours. Maybe you breastfed a baby who did tolerate a cover, or maybe you breastfed a baby who did feed on a schedule, but not everybody's baby is like that. So I think that having confidence in maternal instincts, that mom knows best what her baby needs and where her baby needs to feed, is helpful to a breastfeeding mom.
For Eye on Health, Anne-Larie, WSBT 22.